Canadian Association of Medical Radiation Technologists mock exam, 25 must memorize questions. Question 1. What does CAMRT stand for? Canadian Alliance of Medical Research Technicians, Canadian Association of Medical Radiation Technologists, Canadian Academy of Medical Radiology Training, Canadian Authority for Medical Radiographic Testing. CAMRT is the National Professional Association for Medical Radiation Technologists in Canada. Question 2. Which action is the priority if a patient faints during a procedure? Prop the patient up and offer water. Continue the procedure while monitoring. Position the patient safely and check responsiveness/breathing. Immediately call the referring physician and leave the patient. Patient safety is first. Assessing responsiveness and breathing follows basic life support protocols. Question 3. What should an MRT do if they detect a discrepancy in radiopharmaceutical labeling? Proceed with half the dose. Stop and notify the radiopharmacist. Administer anyway and document later. Ask the patient if they recognize the name. Safety protocols mandate stopping and verifying with the radiopharmacist before administration. Question 4. Why is radioactive iodine, I-131, often given orally for thyroid disorders? Rapid systemic distribution, immediate imaging post-administration, selective uptake by thyroid tissue, easy administration for the MRT. I-131 is selectively absorbed by the thyroid, making it ideal for targeted therapy. Question 5. Which factor primarily determines radiation exposure in a CT scan? Detector array, reconstruction algorithm, tube current, Ma, slice thickness. Tube current, Ma, is the main factor controlling the quantity of X-rays and thus the dose. Question 6. What device shapes the radiation beam to conform to a tumor shape? Compression band, anti-scatter grid, multi-leaf collimator, immobilization device. Multi-leaf collimators, MLCs, use movable leaves to shape the treatment field. Question 7. What is pitch in helical CT imaging? The gantry rotation speed, table speed and patient movement through the gantry, the contrast agent dosage, the exposure time per slice. Pitch is the ratio of table movement per rotation to the beam width. Question 8. Which landmark is essential for an oblique lumbar spine radiograph? Xiphoid process, acromion process, iliac crest, symphysis pubis. The iliac crest is a standard landmark for centering lumbar spine images. Question 9. In pediatric imaging, how should KVP be adjusted compared to adults? Increase KVP, decrease KVP, keep KVP identical, only change Ma. Lower KVP is used in pediatrics to maintain contrast and reduce dose for smaller body parts. Question 10. What is the main goal of the ALARA principle? Reduce imaging time, increase image sharpness, keep radiation exposure as low as reasonably achievable, reduce the cost of radiographic equipment. ALARA, as low as reasonably achievable, is the fundamental principle of radiation protection. Question 11. To visualize the iliac wings in an AP pelvic radiograph, where is the CR centered? 2 inches below ascis, at the level of the greater trochanter, perpendicular to the midline at the level of ascis, 2 inches above the iliac crest. Proper centering at the ascis level ensures both ilium are captured. Question 12. Which projection best demonstrates the radial head? AP elbow, lateral elbow, medial oblique elbow, lateral oblique elbow. The lateral oblique elbow projection clears the radial head of the ulna. Question 13. What is a common sign of an allergic reaction to iodine contrast? Fever, urticaria, hives, increased hunger, improved vision. Urticaria is a common mild to moderate hypersensitivity reaction. Question 14. What is the purpose of an anti-scatter grid? Decrease patient dose, increase image contrast, increase image brightness, reduce scan time. Grids absorb scatter radiation, which improves image contrast. Question 15. In MRI, what does the T1 relaxation time refer to? Transverse relaxation, longitudinal relaxation, echo time, repetition time. T1 is the time constant for longitudinal magnetization recovery. Question 16. What is the primary focus of CAMRT professional standards? Equipment sales, hospital financial management, patient safety and quality imaging care, medical research publication. The standards ensure technologists provide safe and effective care. Question 17. During a mobile neonatal ICU procedure, what is most crucial for dose reduction? Maximizing KVP, using a grid, appropriate collimation and shielding, small focal spot. Collimation and shielding are critical for protecting vulnerable neonates. Question 18. What does the term latitude refer to in radiography? The speed of the processor, the range of exposures that produce a diagnostic image, the distance from the tube to the film, the thickness of the lead apron. Latitude is the range of exposures within which the image has acceptable density. Question 19. Which anatomical structure is best seen on a lateral chest X-ray? Aortic arch clavicles, posterior ribs, interventricular septum. The lateral view allows clear visualization of the aortic arch and retrosternal space. Question 20. What is the role of the shutter in a collimator? To increase the energy of the beam, to limit the area of the patient being exposed, to convert X-rays to light, to cool the X-ray tube. Shutters restrict the X-ray beam to the area of clinical interest.